very excited to be one of the first institutions to have the antibody test available for our patient population. One of the most powerful uses of the test is to look at what the prevalence of COVID-19 is in our entire community. And there definitely are people who have been asymptomatic or very mildly symptomatic who will test positive for having had COVID-19. From a population point of view, we think it is very valuable to test broad swaths of the population to see what the prevalence is. But does an antibody response equate to immunity to the virus? That's not so clear. We know that it's an important part of the immune response, but it is not the whole immune response. A positive test will clearly tell you that you have been exposed and had COVID-19, but it will not tell you whether or not you could possibly be infected again in the future. And so we want to explain this to patients so that when and if they receive a positive serology result, they understand that they should not stop using all of the protective measures that we're asking everyone to use. Now, if you look at other coronaviruses, this isn't the only human coronavirus. If you look at other coronaviruses, antibodies tend to be produced rapidly, and they tend to be present for several years and then wane. And immunity tends to wane for coronaviruses. Whether or not that will be true for COVID-19, there just hasn't been enough time to tell. With the precious resources that we have to distribute over an entire community facing a pandemic, it really is helpful if everyone can get out there and get their flu shot this year. All of the social distancing that we're doing, masking, etc., we're going to hope that that is also going to decrease our rates of influenza in the community. But by all means, everything that we can do to prevent flu is going to help us in our fight against COVID-19.
Okay. It says your value is reactive. The interpretation is reactive. Positive results may be due to past or present infection. So that means I'm positive. I knew it. I think about February 11th or 12th, I got really, really sick. I had really high fever for like 5-6 days straight. I was extremely tired. I could not pick myself up off the couch. And I'm the kind of person that I'm a trooper, and I work through any cold. I'm usually up and about, but I could not move. I hadn't even heard of coronavirus at the time. I had no idea. In fact, the news started coming out in late February. I visited my dad about 8-9 days later, after I was no longer symptomatic, and I did have a dry cough at the time. So maybe close to 2 weeks later, he was sick, and he went to the hospital, and he got extremely sick and intubated and almost died. When my dad got tested and he was positive for COVID, I had a suspicion it was me, because he's kind of a hermit. He doesn't go out too often. And so I don't think that he had a lot of places of exposure. I mean, he could have gotten it from the grocery store, or he has family members that live with him that are out and about. So it's possible he could have gotten it elsewhere. But I was visiting him and helping him with his tech support. And I had that dry cough. So it's quite possible that I gave it to him and the whole household. I think knowing lets me take a little bit more mitigated risk, though I know that it doesn't mean immunity. It means that if I'm positive and my husband happens to be negative, it means that I would rather do some of the things where I'm a little more exposed. So I think that helps me a little bit, not without taking all the precautions, wearing my mask, being careful, doing the social distancing.